Welcome back to the Black Fatherhood podcast series, a collection of videos covering a spectrum of intricately connected topics related to Black fatherhood. I am Dr. Alvin Thomas, Assistant Professor in the School of Human Ecology at the University of Wisconsin-Madison. Where is fatherhood headed? What about Black fatherhood as an experience and the impact of fathers in Black families and Black communities? How do we highlight the work that Black fathers have done throughout history and the work that they continue to do, even though the public may sometimes think of this work as invisible? Having discussed so many angles of the experience of Black fatherhood on this podcast series, we shift our gaze a little bit into the future while trying to understand the past. Joining me in discussing this episode's topic, Black fatherhood, past and future, are Dr. Cleopatra Caldwell, Professor and Chair of the Department of Health Behavior and Health Education at the University of Michigan's School of Public Health, Director of the well-known Fathers and Sons Research Program, fatherhood researcher, interventionist, and pioneer of research on Black fathers, especially African-American non-resident fathers. Also joining us is Dr. E. Hill Deloney, a community activist and advocate for Black families and Black fathers, community project director for the Fathers and Sons program. She is the heart of work at Black families in Flint, Michigan, and was named the mother of Juneteenth in Flint, Michigan. Greetings to both of you. So thank you both for joining us today. And I'd like each of you to take a couple of minutes to just tell us a little bit about the work that you've done and how its relevance or how it's related to Black fathers. Maybe Dr. Hill, you could go first and followed up by Dr. Caldwell.
Well, the Fathers and Sons Research Project initiated my work in the area when Dr. Caldwell came to Flint to introduce the project that they had put together at the University of Michigan. I was part of the community group that they spoke with. And from the beginning, we started, and there were some concerns that we had in the way it was written up. We worked on it for probably about 8 or 9 months, and we've been going ever since then, over 20 some years ago.
Wow. Thank you very much. And Dr. Caldwell.
So I'm glad that Dr. Deloney went first, because an important part of our work is that we do community-based participatory work, and we had to learn how to do that work together. And our project did focus on fatherhood, and that's translated into a number of different Fathers and Sons projects that we've been doing over those 20 some years that we've been together. And I think that's an important part of this whole story, because we had the historical content from experts like Dr. Deloney about the role of Black men in communities and the role of fathers over time, even from slavery time, and what that looked like. And that helped really to fuel us in terms of focusing on what has happened with Black fathers, and also having confidence in Black fathers as being an important family member.
Excellent. Thank you very much. So it sounds like both of you have there's a depth of history across the two of you as far as collaborating on work on Black fathers, but that you also had your own motivation for getting into this work on Black fathers. Dr. Deloney Hill says that her motivation for doing the work with Black fathers came from the introduction to you on that community project. Dr. Caldwell, what was your motivation for getting into this work on fatherhood?
Well, that's a great question, because I was previously involved with research on teenage mothers, and we were interviewing the teen moms and their mothers, and we were conducting these interviews oftentimes when the father of the baby was present and the teenage mother's father was in earshot. And after the interview, they would say to us, "We have something to say about this topic as well." And that was very compelling. So that led us to think about the role of fathers in families. So as we thought about including fathers in the research, we began meeting with potential research partners in Flint, Michigan, and talked about doing a project that involved fathers and sons who did not live together. since that was one of the most challenging populations of Black males. There were a number of mentoring programs that people were doing to address concerns about what was happening to young Black males especially. But our approach to this was to say that many of these young men have fathers. They don't live in the household. Because they don't live in the household, they often get overlooked. And therefore, they're not brought into service, they're not brought into research, they're not brought into many venues to help support their child because they are thought that they're not involved. We didn't take that approach, that we focused specifically on Black fathers. We were trying to prevent risk behaviors among youth, substance use behavior, early sexual initiation, and violent behavior. And our approach to that was really strengthening the parenting behaviors of Black fathers as a way to protect their sons from these health risk behaviors. So working with the Flint community, we developed this intervention and we tested it, and we worked with Black fathers and sons, as well as Black mothers, in order to help us develop the final intervention that we have. But that was the great motivation for me getting involved with fatherhood work, and I have remained involved in this area after all of this time.
Thank you very much. Now, Dr. Hill, I know you said that you were doing this work with Black families in Flint, Michigan, and that when you were approached by Dr. Caldwell and the work that she was thinking of starting in Flint, Michigan, you became the community project director for the program. When you think back to that initial point, or that first time when you and Dr. Caldwell met and you were thinking about the needs of the community and what fatherhood looked like, or the field or the ground on fatherhood looked like in Flint at that time, have you seen any changes or developments when you look at what fatherhood looks like in Flint today?
Yes, there's more public concern about fathers' difficulty in interacting in the lives of their children. There are more fatherhood programs that are offered now than before she started. It created interest because people had not thought about looking at it as research. They knew about all the problems we had with non-residential fathers, as well as fathers who would have been residential if the system had not made them unable to do that. So what has really come, there's much more public concern, and people are joining together to make that a better living experience for young people who are not living with their fathers.
Awesome, thanks. And so Dr. Caldwell, when you think of that space, that fatherhood space, have you seen any trends of development since your entry into this work?
Well, there definitely is more interest in fatherhood from a research perspective, from a service perspective, and a popular media perspective. And I think the initiation of the federal government's Responsible Fatherhood program several years ago was the impetus for a lot of people beginning to pay more attention to the role of fathers in family. I think this stimulated a lot of interest in this area, especially from a policy perspective. Even traditional programs like Early Head Start now have incorporated fathers in the work that they do. So this is a good thing. However, there are challenges in learning how to work with fathers, especially Black fathers in programs.
Excellent. Thank you so much for sharing that. Dr. Deloney Hill, I'm going to go back over to you. So when you think, again, thinking about back then, the past, where you saw fatherhood, how you saw fatherhood, the plight of Black fathers during those times, and now, so think maybe back 10, 20 years ago when you were starting this, what message would you have for fathers today that has changed from maybe the message that you would have given to fathers 10 or 20 years ago? Is there a change in how you would, like what you would share or tell fathers or men who are about to be fathers?
Yes, I would try to have one mother for all their children. And if children have multiple mothers, do your best to avoid conflict and relieve them of care of their children. It's safe mentors other children if it can be helpful. Be mindful for mentors. always be for the adverse childhood experiences if you have so many different mothers for your children. So you want to be your children exposed to as close of a familyship as possible. And, you don't want to have adverse childhood experiences to which your children are exposed. Learn what protective childhood experiences are and insist your children are exposed to them. 10 years ago, my advice would be to maintain your intimate relationship with the mother of your children. If you're unable to stay together, be sure to get joint physical custody or at least visitation rights.
Thank you so much for sharing that. Dr. Caldwell, as you think about the research landscape, but also the practice landscape, so you've connected with a lot of these families in Flint, and I think now you're doing this also in Chicago. If you think back to 10, 20 years ago when you were meeting with these families and with these fathers, these Black men, what would you say to Black men and Black fathers today that would be different from what you would have said 5, 10, 20 years ago?
That's a very interesting question, because my response is that my message actually has not changed over the years. My basic message is that fathers matter. Mm-hmm. Fathers matter for the well-being of their children. Fathers matter for strengthening families, and fathers matter for strengthening communities. So fathers must be involved with their children to help them successfully transition into adulthood. And these messages remain the same for me over these 20 years. When we talk with fathers, we talk to them about responsibility. We talk to them about their role and how important they are as a part of the community landscapes, particularly within Black families.
So I think both of you talk about some of, or at least it sounds like you were hinting to some of these experiences that you've had in very close connection with families. I think Dr. Deloney Hill, you talk about the advice to fathers to stay intimately connected with the mother of their children, or if that's not possible, stay in a positive working relationship. So it sounds like there's like some history, some experience that you've had with connecting with those families. So I'm going to ask you to, if you can, share with our audience one interesting father-related story that either came out of the work with the Fathers and Sons program or just in your work in general.
A father that I will call John proved to me the capacity of Black fathers. What he did in his life is something no other father that I know accomplished. He and the mother of his children never married. She encountered various health challenges and substance challenges. During their children's upbringing, it might be said that he bore the burden of rearing their children. He managed to earn income producing jobs that kept his family afloat. He also doubled duty in nurturing their children. For significant periods of time, she was unavailable to her children's lives. The children matured to become productive adults. What is so amazing to me is how, as a legally single father, he managed to father all 10 of his children with the same mother before he unexpectedly passed away. Married or unmarried, his life is a challenge to all Black men.
Wow. Thank you so much for sharing that. That is not the story that we often hear about Black fathers. We hear about Black fathers being deadbeats and abdicating their role and living with their children. And I think the story of this gentleman that you shared, I think is not very uncommon. We have stories of other men, other Black men who are fully engaged in their families, whether they live in the home or not. Dr. Caldwell, I'll shift over to you and ask you for one interesting father-related story from your long history of work.
Oh, I'd be happy to provide that. In our program on Black fathers and sons, we have worked with a number of extraordinary fathers who had their sons' best interests at heart. One example that I will always cherish is when a son relayed a story about the fact that he was being bullied at school. Now, his mother had gone to the school several times, but had no results, nothing changed. But what he was excited to share in the intervention program was that when his father went to the school to address the issue, the problem was solved. And this son was so proud that he could say having his father go to the school made a difference. And for us, that reinforces not only for the child, but also for the father, how important his role is in his children's lives.
That's a really nice story. Thank you so much for sharing that with us. But as you're thinking about this story in the context of how different organizations like schools, like therapists, like the legal system, social services, medical services, how they interact with families. For those who are providing services to families and are studying families and studying Black families and Black fathers, what message would you offer to them?
My message is simple. I would say don't ignore fathers in the work that you do, because they can sometimes be challenging to recruit into research projects or in service programs. Families will benefit greatly from the participation of fathers when you are successful in recruiting them. Most programs and services are organized to address the needs of mothers, not fathers. Think about what would be meaningful to men and fathers as you plan your programs and services. For example, we don't design activities expecting fathers to share their intimate feelings. Rather, we initially work on problem solving and having them provide assistance. This helps them assess their contributions to any situation, and then they're more likely to be engaged.
When you think of, so we talked a little bit about the history where these 27 years that you spent doing this work and the motivation that brought you into doing this work, some of the things that you've seen, some of the stories that you've come across, some of the lessons that you've learned and things that you want to convey to fathers, but also to providers and researchers on Black fatherhood. But looking beyond, I think the next 10, 20 years, as you pull back from active engagement in some of this work and kind of provide some support and become an elder in this work, what is your vision for Black families and Black fathers over the next 10 or 20 years? And we'll start with you, Dr. Deloney.
Without Black men harnessing their reproductive energies to focus on building one stable relationship with an intentional mother of their children, I see Black fathers continuing unnecessary burdensome challenges. However, if we just remain adequate and have interventional focus on the connection between the health of their children and a stable, intimate union with their mother and father, Black men will be convinced to move the needle to healthier Black families.
Thank you so much. Dr. Caldwell, where do you see, what's your vision for Black families and Black fathers over the next 10 to 20 or more years?
So I think despite all odds, I see most Black men be taking pride in their role as fathers and serving as role models for their children, especially their sons. They know how challenging it is to be a Black man in this society. And many Black fathers are available to their children much more than the popular media or research would have us believe, due to a lack of inclusion. So more and more, I see scholars that are interested in this topic documenting the experiences of fathers and families and societies, and we must continue to support these efforts.
The study of challenges of Black fathers from a historical perspective is understudied. Mm-hmm. Black fathers have serious challenges sustaining stable, intimate relationships with a mother or their child or children. Learning what could motivate Black men to learn how to and focus on how to maintain a home with the mother of all their children. Further learning how to educate Black men on preventing adverse childhood experiences to promote better health and life. Finally, I think developing interventions that raise the awareness among Black men and men, particularly near poverty audiences, that a 92% effective pathway from poverty is stable, non-abusive, emphatic marriages. So all that combines to make that father as precious to a relationship as anyone could be. And people need to understand mothers and fathers are precious. They have 50-50 in that delivery. So I think that would be a little bit more about the young man.
Excellent. Thank you very much. Thank you so much. This is one of the discussions I've been looking forward to for a long time. Because of my own personal connection to it. I've been looking forward to having both Dr. Caldwell and Dr. Deloney Hill on here, because Dr. to be as clear and as transparent as possible, I worked with Dr. Caldwell as a graduate student and as a postdoc, and that's how I met Dr. Deloney Hill, working also in the Fathers and Sons program. And I think back to the experiences, not just with the fathers, but thinking also to the people that you have trained, the number of scholars that you have trained. And by extension, Ms. Deloney, Dr. Deloney, the number of scholars that you have had a hand in training. So I'll ask, and this is one of those kind of follow-up questions that just kind of popped in my mind. As you think of the legacy that you're leaving behind, if you could say something about what you want, what responsibility you want to see that legacy achieve towards the end, it'd be awesome.
I would like to see fathers and young men, and probably along with their parents too, I like for them to be curious to see what can they contribute to their children's life that make them want to do things and ask questions of them and be quiet and listen to children. People don't think children have something to say, but they have very important messages. And if you're not listening, you're going to miss the important part because you got tired of listening when they were chattering. So when you're talking to your child, make sure you give them full attention so you won't miss what they need, what you need to hear. And disregard the golden rule and apply the platinum rule is what my son used to say. And they got a Google's ACE, which is called adverse childhood experiences, and then plan to rear your child in an environment without ACEs. So I just want him just to understand how precious they are and how their behavior at home influences their lives, their children's lives. They're really supposed to be role models, but if they make a mistake, we're still supposed to give them support. And that's what Dr. Caldwell's work has been over all these years, to teaching young men how to be fathers, because it takes a Black man to rear a Black boy to become a Black man.
Thank you so much, Dr. Caldwell.
So I've had the privilege of being a part of many mentoring programs, particularly for junior faculty, for graduate students, and for postdocs. And that has put me in a position throughout my career to have the opportunity to work with some amazing young people who are beginning to pick up this work and certainly taking it to a level beyond where I have taken this work. So that's one of the biggest prideful experiences that I've had, to be able to see, like yourself, young scholars who've been involved with our work to really take it to another level. So this is something that I think is a hallmark of my career. So as I'm winding down my career, I am thrilled that this work will not disappear, because there are so many others who have taken up this mantle. And I think that is something that we can all be proud of, who've had an opportunity of working with the Fathers and Sons Project, but also for those who are in other programs who just hear about our work and they reach out and ask us to either work with them or ask for advice. And I'm happy to do that. So I think we have created an environment working in a true community-based participatory research process to help us understand and learn from the community, while the community also works with the university to produce something that is beneficial for families. And in our initial work, we also worked with the fathers and the mothers and families that were not resident or that were residential families in order to understand multiple perspectives. So that's why I think we have developed something that will stand the test of time.
Thank you so much. Dr. Cogburn, I can think of so many experiences through the Fathers and Sons program that I had personally. And I can think of that period when we started connecting the Fathers and Sons program findings to needs that we saw in therapy spaces as far as integrating fathers in therapy with their children and child-related services. I can think of a number of different experiences with fathers in the programs and the sons in the programs that kind of still stick in the back of my mind. And whenever I start thinking about work with fathers and fatherhood and Black fathers, those stories remain a key building block or a pedestal upon which my desire to continue doing this work sits. But I think above all of that is a saying that I've heard you repeat multiple times, and it's very simple but very powerful. And it's that for specifically for non-resident Black non-resident fathers, it's that non-resident does not equal uninvolved. And I want to end with that comment, that non-resident does not equal uninvolved. From the stories that we heard from Doctors Cleopatra Caldwell and Dr. Deloney Hill, it's that fathers are doing this really important work in their communities, in their families, and in the lives of their children. We need to support them as they do this work. We need to provide the background and provide the modeling for them as they're doing this work. That there's space for fathers to learn, but the resources have to be present for teaching and offering teaching and mentoring for young fathers, connecting older fathers and younger fathers in a way, as Dr. Hill said, that makes it less likely that children grow up in homes where they are facing adverse childhood experiences. So creating spaces that have fewer, if not no, adverse childhood experiences for the children. I want to really thank both of you again for sharing your time with us, your expertise, your experience. This has been a really exciting conversation. Like I said, I've been really looking forward to this conversation and to sharing this space with you. This was the Black Fatherhood podcast series. We hope that everybody in the audience has enjoyed this conversation, and we'll have lots of spaces for resources, available resources for you to connect to. Look forward to our next podcast. Subscribe and follow us, and we look forward to seeing you in the next one. Thank you very much.